PrEP is a medicine to prevent HIV infection. It is a combination of two medicines that are used to treat HIV. This medicine comes as a single tablet. When taken as recommended, it blocks HIV's replication, so HIV is not able to take hold in the body. PrEP is very successful in blocking the transmission of HIV. People who may benefit from HIV prevention medicine include people who have inconsistent use of condoms, people who have had recent sexually transmitted infections, people who use methamphetamines, or people who have HIV-positive partners who have not been able to achieve non-detectable viral load. PrEP is not suitable for everybody. You must be HIV negative before starting PrEP. HIV is checked as part of the regular PrEP screening. If you have had a potential exposure to HIV in the past 72 hours, you may need to go on a different medicine to block HIV called PrEP, post-exposure prophylaxis. If you have had a potential exposure to HIV in the last month, you may need careful monitoring for HIV in the first months of taking PrEP. What are the side effects of PrEP? A rare side effect of PrEP is a slight reduction in kidney function. People who have issues with their kidneys need to be carefully monitored when taking PrEP. If you have medical issues or are on medicines that can affect the kidneys, PrEP is still an option but needs to be carefully monitored. Kidney function is checked for everybody before starting PrEP. It's important to talk with your doctor not only about your medical history but any medicines that you take, including ones that may not be from your doctor. This includes diabetes medicines as well as some medicines that are used to treat pain or inflammation. There is a rare side effect of reduced bone density. If you have osteoporosis, brittle bones, or a family history of issue with bones, let your doctor know. They may want to do a bone density test before you start PrEP. A minor side effect is stomach upset when you start taking the medicine. This may include a little bloating, loose stool, or in some people, constipation. It disappears a few weeks after you start taking the medicine, and it does not happen to everybody. I recommend having acidophilus yogurt. It can help make a difference. PrEP only protects against HIV. It does not protect against other sexually transmitted infections. You will still be protected against HIV whether you use condoms or not. However, other infections can be easily transmitted when condoms are not used. It is recommended to continue using condoms to reduce the risk of other sexually transmitted infections. Before starting PrEP, we organise a full sexual health screening. This includes tests for chlamydia and gonorrhea in the throat, anus and urine. There is blood tests to check for HIV, hepatitis and syphilis. Kidney function is also checked. In Australia, the recommended regime is a single tablet taken every day. When taken this way, it is 99% effective in preventing HIV infection. An occasional missed tablet will not cause a significant drop in protection. Even if you're only taking 4 to 6 pills a week, you still have 96% protection against HIV. However, we encourage you to take the pill every day. I recommend people consider creating a regular routine, something they do every day, and combine taking the medicine at the same time. It can be a good idea to have a spare pill container. You can carry spare pills and keep them in your work bag, so if you forget to take your pill, you have a spare available. If you are still struggling to take the pill, there are some apps that you can put onto your phone that serve as a reminder to take your pill every day. When you start taking daily PrEP, you do need to have at least 7 days worth of medicine inside the body before you will have optimal protection against HIV. If you've had a change of circumstance and wish to come off PrEP, it is recommended to continue taking PrEP for 28 days after your last exposure to HIV. This helps ensure that any HIV that you may have been exposed to is fully eliminated from the body before you stop taking the medicine. Intermittent PrEP is also an option if you have infrequent episodes of risk for HIV. Your doctor can explain how this works. As part of the regular PrEP routine, you will need to come back every 3 months. This will enable you to get a new script, a full sexual health screening, and check of your kidneys. It's also a great chance to talk about any side effects or to discuss ways to ensure that you're able to get your tablet every day. I hope this video has helped you make an informed decision about PrEP.